If you cherish your little guy, this video is definitely for you. But I bet you're unknowingly doing at least 3 out of 10 things that destroy it every day without realizing it. And today, Dr. Minions will reveal these 10 forbidden things along with a medically approved care handbook to keep your little guy not only safe, but also strong as an ox in every battle. Based on recommendations from the American Urological Association, AUA, the European Association of Urology, EAU, and the World Health Organization, let's explore the 10 most important forbidden things. Forbidden thing number 1, ignoring your little guy. Your little guy is not just for fun, it's a health indicator. A study followed men who started having erectile problems, and 7 years later, 14% of them had a heart attack. According to the American Urological Association, AUA guidelines, men with symptoms of erectile dysfunction should undergo a comprehensive medical, sexual, and psychosocial evaluation. Never underestimated when the top says one thing but the bottom does another. It could be a warning bell from your cardiovascular system. Forbidden thing number 2, DIY toys. Don't turn your little guy into a test subject. Guys, don't foolishly believe in miracle tips online like jelqing, penile stretching. According to the International Society for Sexual Medicine, there is no scientific evidence proving this method is effective. On the contrary, it can cause scarring, pain, and deformity. Jelqing can lead to Peyronie's disease, a loss of elasticity in the tunica albuginea, causing penile curvature and erectile dysfunction. These complications may appear months or even a year after performing it, and the consequences can be very painful. Forbidden thing number 4, incorrect hygiene. Too much is also harmful. Cleanliness is good, but it doesn't mean using antibacterial soap and scrubbing vigorously. The skin in this area is very sensitive. For those who are uncircumcised, remember to gently pull back the foreskin and clean underneath to remove dirt and avoid infections. And after urinating, rinsing with water or drying off is a civilized and very healthy habit. Forbidden thing number 4, ignoring red flag warning signs. If your little guy shows strange signs like pain, discharge, ulcers, or blood in your urine, don't hesitate. See a doctor immediately. These could be signs of an infection, kidney stones, or worse, cancer. Penile cancer, if detected early, can be treated with very effective organ preservation. Forbidden thing number 5, loving without control. Overly passionate lovemaking without control can lead to a horrific accident called a penile fracture. This is a medical emergency that occurs when an erect penis is suddenly bent. Without timely surgery, the risk of permanent erectile dysfunction is very high. Always remember, sufficient lubrication and pace control are your best friends. Forbidden thing number 6, turning the factory into a sauna. The testicles need a cool environment to produce sperm optimally, which is why they hang outside the body. Research from the University of Oregon shows that even a 1-degree increase above normal temperature can negatively impact male fertility. A 2-degree increase can cause sperm DNA damage 25 times higher than normal. Therefore, avoid hot baths, saunas, placing laptops on your lap, or keeping your phone in your front pants pocket for too long. Forbidden thing number 7, being too hard during masturbation. Be gentle. Using too much force during self-pleasure, also known as the death grip, will cause your body to get used to that extreme level of stimulation. Gradually, you will become desensitized to the gentler stimulation from a partner, leading to difficulty reaching climax or maintaining an erection in real life. Forbidden thing number 8, smoking and living recklessly. No debate is needed. Smoking is the #1 enemy of erections. It damages blood vessels and reduces the ability of the smooth muscles in the penis to dilate. Studies have shown that smoking doubles the risk of erectile dysfunction. The good news is that if you quit, function can be significantly restored. Forbidden thing number 9, being too hard on yourself. When facing problems, men often blame themselves, creating performance anxiety. According to the MSD manual, performance anxiety during sexual activity is one of the main psychological causes of sexual dysfunction. This creates a vicious cycle. You fail to get an erection once, you worry about it the next time, the anxiety itself causes you to fail again. Be kind to yourself. Everyone has their ups and downs. Forbidden thing number 10, use it or lose it. This saying has a scientific basis. Normally, men have 3 to 5 erections during the night, which is very important for penile muscle health as it delivers necessary oxygen. A Finnish study showed that men who have sex once a week have a 50% lower risk of erectile dysfunction compared to those who have sex less frequently. A recent study in Nature also proved that enhancing nocturnal erections can significantly improve erectile function. In summary, comprehensive care is the key. Taking care of your little guy is not just about personal hygiene, it also reflects your overall health. According to AUA recommendations, men should be counseled that erectile dysfunction is a risk marker for cardiovascular disease and other health conditions. Remember, a combination of a healthy diet, regular exercise, quality sleep, and effective stress management is the golden formula for a healthy little guy. Don't hesitate to seek help from medical professionals when needed. Your health is more important than temporary embarrassment.